Hello, my name is Dr. Daniel Su, and I am a urology oncologist. In this video, I'd like to go over prostate biopsy, MRI-guided fusion biopsy of the prostate. I'd like to give you some clinical background, talk about the differences between different forms of prostate biopsy, and finally, in practical terms, how the procedure is performed. So let's start with the most basic topic. Why do we even biopsy the prostate? Well, prostate biopsies have been done for more than 40 years, and it's the gold standard to obtain tissue from the prostate. Having tissue from the prostate can help your doctors determine what the severity of the cancer is, and ultimately, in combination with PSA and MRI, help us determine what the appropriate treatment methods are. Traditionally, prostate biopsies are done through the rectum, and the standard or the random prostate biopsy are what most urologists used 10 years ago. MRI ultrasound fusion biopsy is a more accurate and more advanced form of prostate biopsy that combines the benefits of an MRI and real-time live ultrasound. So how do we perform a prostate biopsy? Well, the prostate is most accessible through the rectum. So most biopsies are done through the rectum with a small ultrasound probe. The ultrasound probe is about the size of a thumb and can be easily inserted to the prostate. In our practice, we use a multimodal approach to help to make sure the procedure is as comfortable as possible. We use a combination of oral sedatives, nitrous oxide, lubrication with lidocaine, and at the end, a nerve block. The end result is a procedure that's easily done in the office when the patient is very comfortable through the entire procedure. Let's talk about the difference between an ultrasound-guided and an MRI ultrasound-guided biopsy. For those of you who's had an ultrasound-guided prostate biopsy, the MRI addition is very similar. In fact, the position, the numbing, and the setting of the procedure are the same between the ultrasound-only guided biopsy and the MRI ultrasound-guided biopsy. The differences is due to the MRI. So the MRI can provide us targeting information. So say the MRI provides one area of abnormality, then for the MRI ultrasound-guided biopsy, we're able to go to exactly that abnormality and take samples. So the end result is additional samples on the MRI ultrasound-guided biopsy. This actually does not result in any more discomfort or any more side effects such as bleeding. In addition, because we are merging the MRI and the ultrasound image, the biopsy typically takes about 3 to 5 minutes longer. So how do I prepare for this procedure? Well, the prep is actually very similar to your MRI with a few small differences. So the differences are we do want our patients to have food in their stomach before the procedure. When someone is hungry, the procedure can be less comfortable and some people can become dizzy. So if you're doing your MRI and your biopsy on the same day, it's ideal that you have some lunch before you come up for the biopsy. The other difference between a biopsy and an MRI is that antibiotics will be sent to your pharmacy before the procedure to decrease the risk of infection. We will also administer antibiotics in the office of a different type. This way we can reduce the chance of infection to as low as possible. Finally, please follow the instructions that will be sent to you before the procedure to hold any medications and supplements that may cause bleeding. So what happens on the day of the procedure? Well, a detailed instruction will be sent to you before the actual procedure, which includes the address, the location, and the timing of the appointment. The entire appointment will probably take about an hour and a half, but the actual procedure is only about 10 minutes. The reason the appointment is so long is that we will have patients come in early in order to administer antibiotics and to administer any sedatives or pain medication in order to make the procedure more comfortable. And then typically we will have our patients wait in the waiting room so these medications can take effect. And then one of our nurses will bring you to our procedure room and the biopsy will be performed. Afterward, we will ask you to hang out with us for about 5 minutes just to make sure everything's okay and make sure you're comfortable and safe to go home. So what can you expect after the prostate biopsy procedure? Well, because of the nerve block that's administered, you shouldn't have any significant pain. Most men will take Tylenol for up to 24 hours after the procedure. We do expect you to see some blood in the urine and some blood in the stool. Now, if this doesn't happen, that's great. There's nothing to worry about. But if you do see blood in the urine, blood in the stool, this can last up to a week. And drinking plenty of water and rest is the best way to make this go away. Most men, we recommend taking it easy for 2 days after the procedure, and this means no sexual activity and no strenuous activity. But normal living activity is fine, such as going to the restaurant, going to the movie theater. That is all fine for the first 2 days after the procedure. A small percentage of men will develop blood in the semen, and this can be frightening, but be assured that this is actually not a dangerous situation. Blood in the semen can take up to a month to resolve, but it will ultimately always go away. Lastly, the thing we are most concerned about after prostate biopsy is an infection. This is a very rare occurrence. It happens less than 1% of the time. However, if you do have any fevers, any chills, please contact our office and we will treat you accordingly. Thank you for watching.